What's going on, YouTube? This is Lady Locks coming at you. This is just a update video. Wanted to update y'all since my surgery. I know I could have did a video, but I just didn't feel like it at the time. But now, I was like, just come on here, do a video. I know my cheek is looking kind of crazy because I gotta get this tooth taken out. I don't know. I'm having an issue with that. I know my hair look a mess, but y'all don't look at that. But yeah, so surgery was on Wednesday the 27th. For those of the new subscribers that don't know, I went in to have the gastric bypass surgery. So surgery was Wednesday, this past Wednesday. So let me tell you guys what happened. So of course my doctor was doing it laparoscopically. I can't never say that word, which means they make the little incisions or whatever. They do it by camera, whatever. So when my doctor went inside, he decided not to go on with the procedure because he stated that there was not a lot of room for him to move around between my abdomen wall. So that's why he stated that's why he was on me to lose as much weight as I could before surgery, because it would be easy on him and it would make the abdomen walls more thinner. So he said he decided not to proceed on with the procedure because he could have, but he decided not to because he said that could have caused hemorrhaging, and if I had started bleeding on the table and he couldn't have gotten around my organs fast enough because there wasn't a lot of room to move around in there to know where I'm bleeding from, then I could have been at risk. So needless to say, he decided not to proceed on with the procedure. I have, well, y'all can't see them, but I have 4 little incisions where they stapled me up. When I woke up out of surgery, I woke up in the ICU because they said that my oxygen level had dropped so low that they had to put one of those defibrillators down my throat to help me breathe. And so they just had me in there for that day just to monitor my breathing. At first I was a little disappointed because I'm like, okay, do you know how I had to literally, like, forgive me, bust my ass to get to this point to lose the 50 pounds that I did, and for you to go inside and still don't do the procedure? But then again, I had to think about it, and I'm like, okay, he could have did the surgery. A lot of doctors would have went ahead and did the surgery. They wouldn't have cared about your life. They like, hey, I'm still getting paid for it, whatever. So then I looked at it and I'm like, you know what, God, I thank you, because that lets me know that, he's looking more at my life. He cares more about his patients more than the dollar signs. You feel me? So that brought me back to reality. I'm like, some people said change your doctor. It's another hospital with other doctors. They do the procedure. Because at first I couldn't understand why. I'm like, they do this procedure on people that weigh 500-600 pounds, and I'm not even that. But then I had to think about it. It wasn't my time yet. And I'd rather it not be my time and me be disappointed than for him to go ahead and do the procedure and something happened to me and I'm not here with my family. So that snapped me right back into reality real quick. So he said, so I asked him, I was like, well, what is the next step from here? He said, just continue on the regimen that I've been on. He said he doesn't have a magic number on how much more weight I should lose. But, of course, lose some more weight and then go back to the drawing board, and then we see then when the surgery can be done. So at first I was kind of down in the dumps. I'm like, Lord have mercy, I worked so hard to get to this point. Do you know how I've been dealing with stuff on my job and just to keep my insurance and and the money, coming up with the money for my surgery, and just the process of busting my behind to lose this weight and changing the way I eat. I'm thinking in my mind, I did a lot to get up to this point. But then I thought about it, Sharice, anything that is worth having is worth working for. And this is my life I'm talking about here. So I decided, I was like, I'm not going to stop here. If anything, this is going to make me go even harder than what I was at before. So I made up in my mind, I'll probably take a month, 2 months, whatever the case may be, max 2 months. Bust it out, lose this 40 pounds, and then we're going to get that surgery popping again. So that's an update on what happened with the surgery. And to all my new subscribers, hello. Grateful for my new subscribers. I did say once I got past the 100 mark, I was gonna do a giveaway. That's coming soon. I've been so tied up in my surgery and work and everything that I haven't been able to actually sit down and think about what I'm gonna do. But that is coming soon, so I'm gonna do a video about that. About my 100 subscriber giveaway. Anyway, I'm at like 104 now, or 105. I don't know. I'm just blessed to have new subscribers. Hey, love y'all. But yeah, so that was the update on my surgery. Yeah, so, but anyway. So that is a little message for somebody out there. If you think you can't do it and things may not happen when you want them to happen, and even though you think you worked hard and you got to the drawing board and then the plans had to get changed and then you got to go right back again, you know what? It's not the person. It's not how quick you get there. It's the person that endured to the end. So if you think you can't do it, whoever I'm talking to out there, you better get your behind up, get off that couch, pat yourself on the back and get it together, and let's go and get about our business. Because that's what I'm going to do. I'm going to get about my business. And I'm going to get this thing popping. Hello. Goodbye. I know what I wanted to say, but I don't know. I had a loss of drink. Y'all, my hair is a mess. Lord have mercy. Anyway. But yeah, I just wanted to update y'all on what happened with my surgery. I'm just rambling for things to say now. But anyway, so if y'all have any comments, criticisms, whatever, holla at me. 2 fingers. Until next time.